Hello, my name is Christopher Jamie, and I will be performing the Ophthalmic Medication Administration Skills video. Here's my badge. Here's my medication, my supplies. Um, so to start off this video, the skills video, I will go ahead and verify the healthcare provider's orders. Once I verify the orders, I will go ahead and verify the 6 rights of medication administration. The first one being patient, drug, dose, time, route, documentation. Yeah, person, drug, dose, time, route, and documentation. Um, so once I verify the 6 rights of medication administration, I will go ahead and check the medication in the EHR, and I will check the medication against the orders or the order. So the medication on hand that I will be applying today or administering today is Timolol 0.25% solution, 3.4 milligrams or milliliters, 1 drop per eye, twice a day. So that's the medication. So once I go ahead and verify all of that, I will go ahead and grab my supplies and enter my patient's room. I will close the door behind me to ensure patient privacy. Once I do that, I will go ahead and set down my supplies on a clean, flat surface and introduce myself to my patient. So, hello, my name is Christopher, and I will be your nurse today. May I have your first and last name and date of birth? Once they tell me the information about themselves, I will go ahead and verify on the wristband. These are going to be my two identifiers. So once I go ahead and do that, I will ask the patient for any allergies. So Mr. John, do you have any food or medication allergies that I need to be aware of? So once my patient answers, obviously in this case, my patient does not have any allergies. So now I will go ahead and inform my patient about my purpose for the visit. So Mr. John, the purpose of the reason I'm here today is because your doctor has ordered some ophthalmic medication. In other words, eye medication. So what I will be doing is I would be applying 1 drop in each eye, and that's pretty much it. So just to let you know, the purpose of the medication is to treat your glaucoma, and what it does is just eases pressure around your eye. And some of the common side effects that you might experience would be blurry vision, sensitivity to light, slight irritation, but nothing too drastic. If you do happen to experience, do let us know if you experience any chest pains or shortness of breath, inflammation of the eyes, or any swelling in the face or swelling in your throat or neck area. Definitely let us know right away, just to be able to treat that as soon as possible, so we can let your doctor know. So once I describe the process the purpose of my visit to my patient, I will go ahead and let the patient know that there would be some slight burning, stinging sensation in the eye once I have applied the medication. So, Mr. John, so when I apply these drops to your eyes, you will feel some slight burning, some slight stinging sensations, but it's just temporary, so don't worry too much about that. So once I go ahead and I let the patient know that what they might experience when applying the medication, I will go ahead and ask the patient if they have any other questions. So, Mr. John, do you have any other questions for me? Or do you have any questions for me? No? Okay. So, I will go ahead and now lay my sorry. Now I will go ahead and put my patient in a supine position. Ask them if it's okay. Mr. John, is it okay if I put you in a supine position? Just for easier application. Yes? Okay, so go ahead and put them in a supine position. Raise the bed up a little bit. And now I will go ahead and hand hygiene and apply clean gloves. Once my clean gloves are applied, I will go ahead and start by cleaning the lower eyelid of my patient. And so I'll go ahead and just walk them through the process. Okay, Mr. John. So what I'm going to do now is I'm going to grab a warm, damp washcloth, and I will go ahead and clean your lower eyelid. And I'm going to clean from the inner canthus in here towards the outer canthus. I don't want to scrub or apply any pressure to the eyeball, as that can irritate or damage any of those two pretty drastically. So just a slight swipe from inner canthus towards the outer canthus. Okay, Mr. John, I will go ahead and start the cleaning process. So get a clean, warm, damp washcloth and start from the inner canthus towards the outer canthus, very gently. Dispose of this dirty cloth now. Get a new warm, damp washcloth and do the same on this eye. Okay, Mr. John, once again, inner canthus, outer canthus. There you go. So dispose of that. And now you want to remove these gloves. And dispose of the gloves. And now you want to hand hygiene again. And apply new gloves. And throughout this process, you could ask your patient if they're okay, if they're doing okay, if they're comfortable. Okay, Mr. John. So now this is where I will be applying the medication to your lower eyelid or your conjunctival sac. So just to let you know, I will be getting a clean tissue and I will be pressing down on your cheekbone gently and just doing a downward motion to expose your conjunctival sac, which is on the inside of your eyelid. Okay? So with my non-dominant hand, I want to go ahead and grab a clean tissue. And with my dominant hand, I want to go ahead and grab the medication. So what I'm going to do is I'm going to place gently my dominant hand on the patient's forehead. And with my non-dominant hand, I'm going to grab the tissue and slightly press down on the cheekbone downward, exposing the conjunctival sac. Now we'll go ahead and come around, and when I'm 1 to 2 centimeters away from the conjunctival sac, I will go ahead and do 1 drop of timolol, like so, okay? And then once I'm done with that, I will go ahead and get a clean tissue, and I will go ahead and press on the nasolacrimal duct for about 30 to 60 seconds. In a real world solution, that's how long you would press it for. But in this case, to not prolong the video, I would just go ahead and just verbalize. Right before lifting my finger, I want to go ahead and ask the patient to blink. So Mr. John, can you blink please? Thank you. Dispose of this. Now we'll go ahead and apply the medication again on the left eye. I meant to throw that away, just didn't go as planned. But I will go ahead and now do the same for the left eye. I will go ahead and press down on the cheekbone, place my dominant hand on their forehead, and downward to expose the conjunctival sac. And again, 1 to 2 centimeters away from the conjunctival sac, I'm going to drop 1 drop of timolol, like so. And then go ahead and dispose of that. And then I want to get a new tissue paper, and I want to go ahead and press the nasolacrimal duct. Again, in a real-world setting, 30 to 60 seconds to prevent any systemic effects. And then just have the patient blink before releasing. Okay, Mr. John, may you blink? Okay, thank you. Dispose of that. Now I'm going to go ahead and dispose of the gloves. Hand hygiene again. And then just grab the medication and make sure it's closed for later use. And now I just need to assure that my patient is comfortable and they have a call light. Okay, Mr. John, is there anything else you need from me today? Or is there anything I can help you with? Okay, here's your call light. Again, let us know if you have any of those serious common side effects, okay? Again, chest pain, shortness of breath, any swelling in the face or irritation in the eyes, severe irritation in the eyes, or any swollen sensation in your throat or around your neck area. Okay, so now we'll go ahead and exit my patient's room with the medication and close the door behind me, and I will go ahead and document what everything that happened here. Okay, thank you for watching.